Hello and welcome to Virtua Health's Real Talk Women's Health Chat. My name is Nicole Michalik and I'm from 92.5 XTU, and I'm thrilled to be your host once again for this evening. It's one of my favorite things to do. I am so pleased to introduce two Virtua experts for tonight's session: cardiologist Maria Duca, primary care physician Dr. Liesl Miles. So Dr. Duca received her medical degree from Jefferson Medical College and then went on to complete her medical residency at New England Deaconess, fancy, Medical Center and cardiology fellowship at Hartford Hospital in Connecticut. She's the co-director of women's cardiology at Virtua, part of the obstetrics team at Virtua Mount Holly, and chair of the cardio oncology team. Wow, that's amazing. Dr. Duca enjoys traveling, spending time with her family, hiking, kayaking, reading fiction. She's recently engaged with a personal trainer and shared Instagram post she's seen lifting her own weight. Fun. Dr. Miles received her medical degree from Drexel University College of Medicine. That's where I went, not College of Medicine, but I went to Drexel, go Dragons. And she did a residency of internal medicine at New York's Hospital Weill Cornell Medical Campus. She's board certified internal medicine and especially interested in women's health and obesity medicine. Dr. Miles is dedicated to her patients and is passionate about providing the highest quality of patient care. In her spare time, she loves spending time with her kids, many animals, working out in her Peloton. I love the Peloton too, and traveling. Welcome, everyone. Hello, hello. How are you guys?
Hello.
I love this. I love this as a badass women panel. I'm so excited.
Hi, we're very excited to be here.
Yes.
Everyone's questions.
Awesome. Okay, so we're going to jump into it. Studies have shown that as women age, we're more likely than men to have chronic or ongoing health conditions. So let's just dive into those and start with heart disease. Heart disease is the leading cause of death and disability in women. So can we discuss some of the symptoms, discuss the risk factors? Let's touch upon why it seems that why is it so profound in women as we age?
Well, heart disease is the #1 killer of both men and women. It just seems that men started to get better as research focused on studies for men, and women weren't getting better as quickly, and some of the procedures don't do as well as women. So we need to understand our risks, take our symptoms seriously, and make sure everybody else takes our symptoms seriously.
Yes.
So sometimes they put it off on anxiety, and we're not always just anxious.
Right.
So
can you elaborate on that a little bit?
Yeah. So the most common symptom in women and in men is chest discomfort, not necessarily pain, but a pressure, a tightness, a heavy feeling, usually in the center of the chest, but it can be across. But more often in women than men, we can have atypical symptoms. So it could be tightness here in your throat or your jaw. It could be either arm, not just the left arm. Everybody knows the left arm, but it could be right arm tightness. If it comes with activity, goes away with rest, the discomfort in the arms, in the chest, throat or jaw, or in the back. Same level like you would point in your chest, but right in the middle of the back between the shoulder blades. Those are the more common symptoms that women can have that could be signs of heart disease. We can also just be out of breath, out of proportion to what we're doing, or unusually fatigued. Make your bed, you want to get back into it. So it can be subtle and much more subtle in women than men. It can be a heartburn-like sensation. A friend of mine said it felt like a piece of meat was stuck there. When you swallow and you get that piece of meat stuck, that was her feeling.
And was that a continuous feeling for her, or it went away and came back?
So if it's a tightly blocked artery, it'll cause angina, which means discomfort that comes with activity goes away with rest. If it's a heart attack, it's going to last. So in my friend, it lasted. She had just finished her step aerobics class, felt fine through the whole class, and then left, and she's like, oh, it's not right. I got some heartburn. Went home, took some Maalox, didn't go away. Her husband's like, oh, it's heartburn. And she's like, no, I don't know. Maybe I ought to go get it checked out. But, she's like, it wasn't bad. So she took herself to the ER. She's telling, it just doesn't feel right. I don't know. And they're like, well, they took her back and they put her on the side with people that have colds and heartburn and stuff, did an EKG, and then showed it to another cardiologist. And they look at it and they're like, yeah, where is she? She needs to be, she's having a heart attack. Move her over. Got her over to the sicker side of the ER and she cardiac arrested. So had she stayed home, she might not be today. So she
Right.
listened to her body. She knew it wasn't right. And that's the most important thing. Something's going on and your brain is telling you this doesn't feel right. And especially if the discomfort is lasting for more than 20 minutes, you
Right.
have to listen to your body.
You have
Go
to.
to the emergency room, preferably by ambulance, because around here, the ambulances will do an EKG. So if you're having a heart attack, they'll see it and they'll whisk you right back and start treating you right away. So there's not that delay.
That's so good to know. And that's so important for people to know. Because a lot of people are like, I won't call the ambulance. Like, I don't want to, I don't want to be a burden. But really, the ambulance could save your life.
Or be embarrassed because your neighbors are going to see the ambulance pull up.
Yes. Yes. 100%.
Please, I'd rather you be embarrassed.
Yes, please.
Sit home and have your heart attack on the way to the hospital.
Yes, 100%.
That's not good.
Obviously, high blood pressure and high cholesterol can lead to heart attacks and strokes. So can we talk about reducing your risk, how important it is to continuously get checked? Obviously with high blood pressure, getting your blood work, you can do that once a year. But in regards to a stroke, how do we make sure we're managing that? And how do we make sure we're staying on top of that?
Well, some of those are just two of the risk factors. So first of all, know your risk. So seeing your primary care physician, Dr. Miles or similar, at least once a year, especially as we get older, and postmenopausal women are higher risk for heart disease. So know your numbers, know your cholesterol, know your blood pressure, diabetes, your blood work to know if you're diabetic, that's a risk factor. Other risk factors you can't change. You can't change your family history. But if mom had a heart attack in her 60s, dad in his 50s, you're at risk. If you smoke, it's a big risk factor. If you have blocked arteries elsewhere in your neck or in your legs, that's a risk factor. And then women have extra risk factors, things to do with pregnancy. If you had high blood pressure, eclampsia, preeclampsia when you were pregnant, again, you can't change that, but you need to know that puts you at risk. If you had diabetes when you were pregnant, puts you at risk. If the baby was born really early, like a month early, that puts you at risk. Can't change any of these, but knowing that you're at higher risk, getting that care earlier, seeing your primary care doc, seeing a cardiologist as you get a little bit older, knowing what the numbers are that we can change, because we can treat your cholesterol, we can treat your diabetes, we can treat your blood pressure, make the lifestyle changes. And the risk factors are the same for strokes and heart attacks. So if you're protecting yourself from one, you're protecting yourself from another. Right. And on your general, yearly physical, they'll listen to the carotid arteries in your neck. If they hear a funny noise, they'll do an ultrasound, look for blockages.
Right.
If you, if they're really worried, if you have a lot of risk factors, if there was an early stroke, they may do the test anyway. So, but we don't know unless you show up and tell us what's going on.
Yeah. And not being afraid to get the test. And I think it's important too for people to realize that genetics also play a role. One of my really good friends, she's a runner. She does half marathon. She's barely 100 pounds and has very high cholesterol. And it's just her genetics. And so she tried to do it, obviously she works out all the time, but she had to go on medicine. But it's like, she was very adamant about she knew it ran in her family, her mom, her sister, her aunt. So she knew that they could be, so every year she would make sure she would get it checked. And it made her crazy because she's like, I'm doing all the right things. So I think that's important for women to know too, that sometimes it's important to know that even if you may feel okay, there could be something else going on. So it's important to stay up on your blood work and seeing your primary and getting checked and all that stuff.
And Dr. Miles, you can probably speak to, what the recommendations are about how often to check the cholesterol in their 20s, 30s, 40s.
Oh, yeah. I typically check a yearly cholesterol in most of my younger patients. Sometimes, I mean, as people get older and they're on meds, they might get a check more often, but I definitely start checking once a year once people are in their 20s. And then, I like to get a baseline EKG on patients, like just so I know in case it changes. A lot of people have never had that. That's when they put the leads on your chest and they look at the heart rhythm. Because sometimes we can find stuff there that might be worth investigating too. And then, and then I would send you to Dr. Duca and she would work her magic.
Yeah. It's amazing. So let's actually talk about osteoporosis, because that's obviously very common in women, especially women as they age. It weakens the bones. They could fracture. They could break more easily. So people talk about the risks as you enter menopause or as you finish menopause. Your bone density decreases with estrogen. So let's talk about that, about some bone density tests, some supplements. Like, how could women stay on top of this?
Okay. Yeah, so osteoporosis is it's a common problem, especially after menopause because of what you said, because your estrogen levels go down and that weakens your bones. So the best way of, to treat osteoporosis is actually to prevent it. And, that's by making sure you're getting enough calcium and vitamin D in your diet and that you're doing weight-bearing exercise. Usually we recommend about like 1,200, 1,300 milligrams of calcium in your diet. And I mean, you can get that from a variety of things. If you don't like milk, you can get it through green leafy vegetables. Sometimes they fortify orange juice with calcium and vitamin D. That's kind of one of those things it actually is absorbed better with that orange juice sometimes. So I actually did that for my kids to make sure they get some vitamin D and calcium. But yeah, you can get it from a lot of different sources, and then making sure you're doing weight-bearing exercise is a good thing. Walking, doing light weights, stretching. It doesn't have to be running a marathon. It just has to be, keeping your body active, and that keeps your heart healthy too. So it keeps everything healthy. Exercise is good for everything, including osteoporosis.
Right.
When you're smaller in frame, like when you're a smaller person, you're more at risk of osteoporosis. That's kind of important to know. It's been one of the only things that being thin kind of actually is a negative thing for. But so, and anyone that has a family history of like multiple relatives with osteoporosis, like, they might be people that need to get screened a little bit earlier. And there's also some medications that people are on long-term that can lead to early osteoporosis, like some of the stomach medicines that we use for reflux, like Nexium and Protonix, and these other medicines that impede the acid, or they get rid of the acid in your stomach. They can actually impede the absorption of calcium, vitamin D. So those are things to look out for. And chronic steroid use. Some people that have other medical conditions that have been on steroids for a long time also are more predisposed. The problem with osteoporosis is that you're just at more risk of breaking a bone. So if you go out to shovel snow and you fall, it could be a hip. And that's these are, when you break a hip or these other bones, especially as you get older, it's so much harder to heal and recover. So we want to avoid that kind of thing. We have a lot more medical options for osteoporosis now than we used to as well. It used to be, you had to take something daily. Now we have, injections you could do monthly or yearly even. So it's not as bad as it used to be, at least to get treated for it now.
Right. So the goal is to stay on top of it before it gets too bad. And I think it's what you said about medicine. A lot of people just think, oh, I'm going to take medicine for my heartburn, not thinking that it might interfere with calcium or it might interfere with their. So it's important to talk to your doctor to know what all medications you're taking so you can avoid that. And so what about a DEXA scan?
So yeah, so typically we start doing DEXA scans at age 65, but if you go into menopause earlier than that, then you can get a DEXA scan earlier. And that looks at, certain bones in your body, sometimes your wrist, sometimes your lower back, sometimes your hip, they do. And they take x-rays to look at like how thick your bone is. And they compare it to someone that's age 20 or whatever. And that's how you know how much density you've lost. So that's a good test, and you do it every usually 2 to 3 years to keep track of things after menopause.
Yeah, that's so interesting. So let's talk about mental health. We know the ability to think, learn, remember it, and it often changes as we get old. What conditions are common for women in regards to mental health and as it changes as they get older?
Well, I think that the hormone issues that are associated with even perimenopausal, not even just menopausal, but even in your 40s, it starts when the hormones start shifting. They see a lot of anxiety and depression. It's hard to suss out what's due to that. And also, like, we have a lot more anxiety and depression in general after COVID. So it's
Yeah.
like, it's one of those things where it's super common in the population, but you need to be willing to discuss, like, these symptoms with your doctor. And sometimes it's not profound sadness, depression isn't. Sometimes it's just a disinterest in life in general, or a
That's
lack of
important.
passion.
Yeah. I don't think a lot of people realize that that is a symptom of depression. It's just being apathetic of
Apathy.
like just being like, I don't feel like it. Nah. And it's like, am I being lazy? Do I need rest? Is this depression? Like, it goes back to not being embarrassed to talk to your doctor about this. And, I think so many women are just used to kind of like putting our heads down and being like, I got to work and I got to take care of my kids and I got to do the husband and I got to shop for the birthday gifts. And you just kind of think you're tired and you don't realize that you could feel better, and talking to friends and just talking to other people and realizing how many women suffer with this. I definitely lean more on the anxiety side. But when you brought up anxiety after COVID, I go to this really great therapist and she talks a lot about just how much anxiety is prevalent with the amount of information that's being thrown at us at any given time and how that's not normal. That
No, we're all constantly overwhelmed.
Yeah, even 10 years ago, the access to social media and every second of every day getting thrown horrible images, and that adds to it. And especially for people who are a little bit older, who didn't grow up in this technology space, it's like, it is literally almost like mind altering in a lot of ways.
I tell a lot of my patients to just turn the TV off. Especially the news. If you want the TV on, put on the game show network or put on a comedy or stop watching the news 24/7.
Yeah.
Because it's never good news.
Right. Right.
And it brings you down and it makes you anxious.
Yeah.
It's just not. And the other thing I wanted to put in with the perimenopausal mental health, it can also be irritability from personal experience.
Yeah.
They say that the estrogen levels affect the serotonin in your brain, and it can make you cranky and irritable and, do things. And the medicines really can help, and diet things too. My GYN was very good with that, about lifestyle changes to help modify those serotonin levels, and medication if you need it. I mean, it let me be me again during that time of hormonal fluctuations. But you have to talk about it. And people don't want to. I'm like, I'm fine. If you helped me do this and do this, I wouldn't be so cranky. But it took a little bit of doing from my husband and my mother to sit down and go, you're not yourself. You need to talk to your doctor. So you don't always necessarily recognize it, but it certainly is something that happens, especially in that perimenopausal hormonal fluctuation time. So something to recognize.
So the other thing was with depression is sometimes people that are older, sometimes it actually comes out as forgetfulness or memory loss. It's called it's called pseudo dementia. So you have to, like, a lot of times when I see people that are complaining, when they say they have memory loss, I do assess them for depression symptoms too, because sometimes if you treat the depression symptoms, their memory issues get better.
Interesting, because that was my next question about being evaluated for dementia and Alzheimer's. And what does that look like? Do you talk to your doctor about that? Is there a special test, that women can take? What are your recommendations to go about assessing for that?
I mean, memory loss is it's not an easy thing to assess. I mean, we can do basic tests as primary care doctors. We do like little mini mental exams on people. I mean, but there's also neurologists in the area that do full on like neuropsychiatry testing sometimes. And that's, sometimes we do that, especially if you have a family history of early Alzheimer's or something like that, and you might be more likely.
Right. Right.
But then you should do things that, the same things that help with anxiety and depression, probably would help with delaying at least the onset of Alzheimer's or, dementia. Things like exercising, keeping your brain active, sleeping the moderate amount, eating like a healthy, balanced diet, So at least there's hope there.
Playing Wordle and connections, doing some word puzzles, right?
Yeah, no, all that stuff
Especially
is
if you're
great.
competitive, you have to be competitive with work.
Play pickleball, right? Like pickleball, it's do all the things, you know.
Friends, have friends.
Yeah, I think that that's hard. So it's interesting. I'm a very extroverted person, and I'm very fortunate that my family is also. So I grew up with both of my parents. Even my dad, unfortunately, just passed away at the end of August, and he had Parkinson's. He suffered for almost 30 years, and but he had so many friends, and it's so a lot of men don't. And my mom has so many friends, and my aunts, and so I grew up with that. But I see a lot of people, especially as I get older and I'm in my job, there's a lot of people who consider themselves more introverted that aren't used to having a network of people. And I think it's important maybe to talk about now, if there's recommendations, if somebody, maybe they've been married, they're the kids, and now they are in their late 50s, early 60s. And it's like, how do I find a new network of people? I think it seems overwhelming for people.
I usually encourage people to go out and like either do a volunteer position, like I have a lot of people that work with animal rescue.
Yeah.
I have a lot of loners that work in animal rescue. They all find each other. You do what you're passionate about, and you find people that are passionate about that.
Yes, that's such a good, yes. Because I'm not like I get it. Cause like there's people who are like, I want to volunteer at the SPCA. I'm like, I'm not going to clean cages, but you are. So that's awesome. So you're right. It's like they will find each other. And even like, listen, animals are therapy, right? So even if you do like there's a reason that people have emotional support animals. So maybe you do feel like you go work at the SPCA or you volunteer at the zoo or like something like that, that could fill it. And then you're still getting time with other people, and then you're also like kind of filling that void with animals and stuff too.
Well, adopting an animal is a great idea too.
Yeah,
if you have the bandwidth to do it.
Yeah, absolutely. Yeah,
like I said, finding other hobbies. Going if you like to quilt, you can go join a Joanne Fabrics or something and learn how to make more fancy quilts or
aqua size.
Yeah.
Well, and I think too, because we do have access to finding information on the regular, if there's something you into, you could just Google, and we're fortunate that we live in a very populated area. There's a lot of stuff to do, whether it's Philly or South Jersey, that you can find interest. Facebook's a really good place for groups. People don't realize that there's a ton of really great Facebook groups that you could join to find people in your area doing stuff. There's probably so many groups for women over 60. There's probably like women over 60 Cherry Hill, women over 60 Mount Laurel. You know what I mean? Women over 60 Cinnaminson. I bet you there's groups for all that if you just do a little research and look for it, which I think would be very beneficial. But it's kind of like encouraging. I think a lot of times too, it's like women, and this is such a huge conversation, but it's like, you're not used to, you're like, oh, well, I'm 60. So was a mom and, and a wife. And it's like, no, like 60 is young, like get out there, feel good. Even if you've never done it before, maybe you did something in your 20s and 30s, try to maybe you love to ski. So maybe now you're going to do cross country skiing or like something like that, Don't put limits on yourself, because I feel like women put too many limitations on themselves. And I'm like, no, you're amazing. All right. So let's move into food and basically diet, right? So not diet as in like don't eat, but diet as in like maintaining a healthy lifestyle. We ran the gamut over the last couple years. It's, people are talking about keto, and then, which is just like a new Atkins, and now it's Mediterranean, vegan, right? People hear a lot of stuff about vegan and heart health and how it's so important to be a vegan. Is that good? Is that not? And then obviously the Mediterranean diet is super, super popular right now. So let's just talk about that a little bit. And, some people I think get overwhelmed with, what do I eat?
Well, I think, the first thing you said, like the fad diets are not ideal.
Right.
Because it's hard to live the rest of your life that way.
Yeah.
And yeah, I have a partner that swears by the vegan diet, plant-based diet. It's wonderful. And it is. It's very, very good, healthy for your heart, healthy for cancer risk. It's very difficult to live that way. He'll always say to me, you should be vegan. And I laugh because I'm like, yeah, no, I'd rather die a little bit younger and eat what I enjoy,
Right.
But you find what you like and make healthier choices. Mediterranean is really good because, you know, you're eating your fish, your chicken, your beans, your vegetables, your whole fruits. Berries are really good. DASH diet is what the Heart Association likes for high blood pressure. It's dietary alterations to stop hypertension. It's very similar to the Mediterranean diet.
Yeah.
I like Weight Watchers because it teaches you how to eat in different situations. So you're going to a birthday party? Okay, look, this is what you do. You're going to eat out. Here's your healthier choice. Here's how you make good choices. And you can live that way. It's very, very hard to live the rest of your life cutting out a whole food group, cutting out carbs, cutting out, you know, it's difficult to do that. So you need to look at what you like to eat and have everything in smaller amounts. I love my chocolate. I have dark chocolate Dove candies in my refrigerator, the squares, the small squares. That's what I'll have for a treat. Sometimes 2, sometimes 3. But you know, everything in moderation, and you're overall eat a healthy diet and put it in with your exercise and your other good lifestyle. You know, if you don't like fish, fine, don't eat fish. Eat the chicken, eat the poultry, eat a leaner cut of meat. You know, there's some data that grass-fed beef is better than, you know, regular old, you know, beef that we get, you know, on the grocery store shelf. You know, it's more expensive, but the healthier things tend to be, and that's a shame too. You know, the organic fruits and vegetables are more expensive. The, you know, grass-fed beef is more expensive. But you know, you've got to look at things and budget and make the right choices. Stay away from the fast food, stay away from prepared foods. It's easier, it's quicker, but it tends not to be healthy.
Yeah. Well, and I think too, it's interesting where, you know, we live eating fast, and I hate assigning good, bad to foods. I feel like we've grown out of that, right? But there are foods that are better for you is probably the better way to put it. But it's like when you think about the standard American breakfast, I was in Italy for 2 weeks and they literally, you're in Florence and it's like American breakfast. It's so embarrassing. And it's, you know, a cheese omelet and bacon. And I was like, oh my God, I'm so embarrassed, you know? But like that is what we have been accustomed to, that like you're going to eat a bacon, egg, and cheese on a bagel for breakfast, when like really for breakfast it should be like a Greek yogurt with blueberries and like, you know what I mean, something that's, why couldn't you have a green juice for breakfast with a little bit of protein? So I think it's hard sometimes, and especially when people are older, where they kind of grew up with this, I'm gonna have cinnamon toast crunch and whole milk for, and it's crazy because my brother's a teacher, my mom was a teacher, and I just read this article about like what sugar does to your blood sugar and kids and ADHD and like the red dye and all that stuff. And, you know, my brother was always so hyper as a kid, and he ate cinnamon toast crunch and apple juice every morning for breakfast. And I was like, Andrew, but you know, it was 1990. So it was like, that's just what you did. So we know better now, but I think sometimes people do get overwhelmed. So yeah, so I think people maybe get overwhelmed of kind of like what to eat, what to do, and how to know, you know, I mean, I assume like Dr. Miles, since you have patients that come in to kind of see you for overall health, do they talk to you about that kind of stuff? Because
I talk about diet all day long.
Yeah.
I mean, I like to try and make it easy for people, because everyone's so busy, and you know, they don't have time. Like a lot of times they don't have time to meal prep, and they're stopping at fast food places. So I try and come up with strategies for people to eat a little healthier, you know, they're out and about all the time. And sometimes it's like as simple as just keeping a protein shake around, like if you're starving, so you can have that instead of going and getting a Happy Meal or something, you know?
Yeah.
And for breakfast, like I always encourage, like, you know, definitely you want a lot of protein in your breakfast, protein and healthy fats, because that's what keeps you fuller longer. And the other thing was with that is if you eat protein and kind of healthy fats sooner in your like meal, that helps you process carbohydrates better. So it's not that you can't eat the carbohydrates, but you might want to save them towards later in your meal, because you'll eat less of them and your body will actually process them better, especially if you lean towards diabetes. The other thing is with diet is older people notoriously don't get enough protein. Like,
Yeah.
so that's why these like, like these protein shakes can be really helpful. So like the Fairlife ones or some, Ensure came out with their own version. Because
Yes.
you lose a lot of muscle as you age, and
Yes.
you need to keep that, because that muscle is what helps you burn fat and helps you be strong. Like, you need the muscle.
Yeah. Yeah, I was a maniac with my dad, where I was like, Dad, you have to drink protein shakes. I brought him like the Bella blender and and all that stuff. And yeah, and I think it's people being overwhelmed with like, what are my choices? What do I eat? And yeah, and it's like you're working, you're moving around, you're on the go, and you're like, I'll just go right into Wawa. And you're like looking you're like, do I really want to get this apple, or like maybe I'll get a shorty, and so it's having, and I do think a lot of people don't realize how, when you balance your blood sugar, how you don't have those up and down cravings, that you're just more satiated. The difference when you're eating a protein with some fat and a carb, a fruit and a vegetable, like how different you feel. And you're just like, oh, wow. Okay. Like, so it's educating, and not being afraid to talk to your doctor, not being afraid to ask your doctor those type of questions. All right, let's move into sleep. Obviously, sleep is huge. Proper sleep is just important. It helps you stay healthy and alert. Recommending 7 or 8 hours a night. So many people do not get that. Excuse me. So what are some tips for better sleep?
If I had a really good answer for that, it would be nice. I'd sleep better too.
Like, I would be a billionaire. Yeah.
I would just be happy if I slept better. I think it's one of the postmenopausal things that are the way you just sleep is difficult. Falling asleep. I mean, sometimes I'll be exhausted after a day of work and I'll be laying there and have a hard time sleeping. But there's the, guided relaxation imagery. There's meditation apps. Try and shut off the blue light things, your iPad, your the television. Try and stick to reading, lower the lights a little bit. You do need to get 7 to 8 hours if you can, because that's when your body heals.
Mm-hmm, mm-hmm.
I mean, your bed should be only for sleeping and sex. Like, you shouldn't be eating or watching TV or on your phone. We're all guilty of all these things. But theoretically, if you have sleep issues,
especially when we're watching Taylor and Travis, like we're just watching Taylor and Travis. It's like we're on our phones so much more now.
I mean, they're a really cute couple.
I know.
Yeah. Anyway. The other thing is like, so sleep hygiene, like Dr. Duca was saying, is super important, and like keeping on a schedule. Exercising regularly helps you be more tired, at night. You can wear yourself out. And then, if all else fails, like melatonin is not a bad option.
That's what I was going to ask. What is both of your takes on supplements for sleep?
I agree. I think melatonin can help. You've got to be careful, because there've been some studies out about the differing amounts in some of the supplements. I always tell people, start, especially older people, start with the lowest dose and see how you do with that. Sometimes I find just a Tylenol helps me relax, takes away those little aches and pains from the day, help me relax. Maybe it's, just in my head, but I find if I'm laying there and having trouble sleeping and I go take a Tylenol, I fall asleep a little bit easier. Things like that.
Sometimes I prescribe medical marijuana for bad insomnia. I
was going to say that. What's your take on medical marijuana and CBD?
I think like indica strains of marijuana are really great for going to sleep. I generally tell people to eat it in the form of a gummy, or or with like a lozenge, or drops or anything like that. I've had a lot of success even with my in all ages with that. Because the thing is, all the prescription sleep aids, they're very addictive. They cause a lot of problems in the long run. The Ambiens, the Xanax, all these things are very addictive. Once you get on them, they're very hard to come off of, and they're not natural substances, and they can cause issues. So I feel like if you're going to use something, you got to make sure it's something that's like relatively safe. And not that we have much data on marijuana for sleep, but anecdotally, and like all of my patients that use it love it. They say it helps.
Cool. Yeah, good to know. All right, let's move into women what should they begin or stop after 60? So risks for certain cancers increases as we age. Obviously, early detection is absolutely essential. And colonoscopies, mammograms, lung cancer screenings if you're a smoker. So do we stop any of that? Do we double up? Do we continue? Do we do it once a year?
Okay. I mean, the answer is different it's an individual based answer, but generally, like, mammograms we do every year past 40. Sometimes we start earlier if people have family histories or other issues.
Yeah.
And we keep going with them because, we find something, you find something early, it's pretty relatively easy to take care of it, and then colonoscopies, they recently lowered the age to 45. It used to be 50 because of the increasing rates of colon cancer. Those you start at 45, and generally they're every 10 years unless you find something, in which case they'll, increase you to every 3 or every 1 or every 5, depending on what they found. And we keep doing those until it's like kind of an age where it might not be like as safe to do it. Like, you look at the risk, you look at the person, their overall health, and we see like, what are the risks versus the benefits of a colonoscopy? Like most people at age 80 aren't getting colonoscopies, but like a 75-year-old, sure. Like if they're in good shape and, they want to get screened or there's an issue, there's no problem there. So that's colonoscopies. And then lung cancer screenings, we do CAT scans if people have had, smoking history, like a significant smoking history. So that's something to also bring up with your doctor. If you've smoked in the past for many, many years, sometimes we do a CAT scan and we can find things early. It's always better to find things early than find them late. Some things, are harder to find than others. And then pap smears, past menopause, they are not like you can start dialing back the amount of times you have them. They're usually, every 3 to 5 years once you've had normal ones over a period of time. If you've had like issues with HPV or abnormal pap smears, then that's a different kind of situation that you have to talk about with your gyno. But I mean, we do stop them at some point, but then you're still supposed to see your gyno for like an annual just pelvic exam.
We actually talked about that in one of our sessions about how, because women, 60 is young now, and people think, oh, we don't need to do it anymore, but you're talking about ovarian cancer and fallopian tube cancer, and it's important. And a lot of women still are sexually active, and it's
STDs are big in the elderly.
Oh yeah, you know what I mean? Those retirement communities, they're having a blast.
Lots of syphilis.
Like college 2.0.
Yeah.
So like, I think a lot of people think, oh, I can't get pregnant, so I don't have to go. And it's like,
no one uses condoms anymore.
Yeah, no, Barbara, you gotta get swabbed. You know what I mean?
Yeah. Yes. You should be getting STD testing regularly if you are having unprotected sex. It doesn't matter what age.
Right.
And no one's judging you.
Like, get your kicks. You just have to be safe about it. You know what I mean? And not feel, and just think that things could still happen. Like you can still get an STD or HPV or something like that, even if you have gone through menopause. And so talk to your doctor about that, just because that might not be your norm. Don't be ashamed to bring that up. And obviously all of your take on yearly vaccinations, right? So we're doing flu, RSV, pneumonia, tetanus, shingles.
Those aren't all yearly though, because that would be ridiculous. I mean, the pneumonia shot is every time they come out with a new pneumonia shot. It's like, it kind of ends up being like every 3 to 5 years, because they come out with now it's Prevnar 20. It used to be Prevnar 13 and Prevnar 23. Now there's 20. So it's like every time there's a new one.
Okay, what about shingles?
Shingles is a one-time, it's a 2-shot series. You do it once after age 60.
Okay.
No, they moved it lower now. I think it's
lower 50.
Yeah, I think it's 50 or 55 now, because I got mine.
Sorry, you're right. You're right.
Yeah. And then what about tetanus?
That's once every 10 years.
Oh, okay.
That's not so bad.
Obviously, flu is every year, and COVID should be. Are we doing it every year, every 6 months, when the new booster comes out? What's the scoop with that now?
It's probably going to turn into a yearly vaccine, like the flu. It's just
right.
The newer one just came out. So a lot of people are getting that Spikevax one. But yeah, I think there's probably going to be a yearly COVID shot that comes out that's like aimed at the strains, the same as the flu shot is pretty much.
Right. Which makes sense. Yeah. All right. So let's jump into the Q&A. So the first one we have is urinary incontinence. Should I take an oral medicine to control it?
You might, they do help, but I would always recommend seeing we have a really good urogynecology team at Virtua. And they're like a special kind of urologist that literally looks at like the reasons for why people are incontinent, and they can test for certain things, and then they can actually tailor your treatment a little bit better. Or sometimes they can do Botox injections into your bladder instead of taking an oral medication. Sometimes there's a surgical correction if like something's like falling down. So yes, they might need an oral pill, but like I would see a specialist first and like get the testing and like, really, because they could cause a lot of side effects, like, like dry mouth, constipation.
Physical therapy helps. There's physical therapy. It's kind of a strange physical therapy, but it can help.
Yeah, no, I mean, pelvic floor physical therapy is amazing. Yeah.
We have a good program at Virtua too.
Yeah. All right. So we're going to try to get through these a little bit rapid fire because there's a lot coming in. All right. So I'm going to start to the top about somebody asked about calcium and if they don't do dairy, but we answered that where he said a lot of leafy greens have a ton of dairy. Tofu has dairy. That's a simple, you kind of Google, I think spinach is huge in dairy.
Yeah.
And vitamin D like that. And that's a really easy thing where like you make a shake, you take your protein shake, put some ice and some spinach and you're good to go.
Vitamin D supplements out there too. And we really are, I wanted to speak up before, but it didn't fit in, but we're very vitamin D deficient. Most of us are indoors most of the year with our jobs. And it's important to get that checked with your primary because it's your bone health. And we don't know, you don't feel it. You don't know you're vitamin D deficient, but it's an easy thing to treat with supplements and with foods, and it's worth looking into.
Yeah. And I have hypothyroid. So that is a symptom of even lower vitamin D. So I always take a vitamin D. So make sure you get your thyroid checked in your panels too, because that's a big thing that a lot of women don't realize. What can I do to lower my sugars? I was just diagnosed with pre-diabetes.
So that would be about lowering the amount of simple carbohydrates in your diet. So there's things like, breads, pastas, rice, sugary foods, candies. You also want to avoid saturated fats in general. They're not good for your sugars either. That's the best. And we have tons of nutritionists. Like if people need help with like counting their carbohydrates and that kind of stuff, it doesn't have to be complicated.
Yeah, it could just be one of the
more protein, more veggies, and make the carbs a smaller portion, and the whole grains, not white rice, brown rice, wild rice, sweet potatoes instead of white potatoes, quinoa instead of rice. It's a great substitute and it's a protein. And you're getting what feels like a carb without it. Your breads, a rye bread is great. They were saying that rye actually has some of the things, stimulates things that Ozempic stimulates. So does barley.
Oh, so increase your fiber. Yeah. Increasing your fiber is good for everything, especially weight loss and bowel, nobody likes being constipated.
Right. Yeah. That's the worst. Why does your skin change as you get older? Mine seems to be drier. That's a question.
A lot of it's hormonal changes that naturally happen over time. Everybody needs a good dermatologist at least once a year to get a skin check. But with that dryness, I like using like a hyaluronic acid serum. I find that really helpful for like moisture because once you get your 30s, your skin does kind of start to dry out.
Yeah.
And making sure that what you're using to wash your face is like very gentle and that you're not putting things on your face that would dry it out more.
Right. How do I lose belly fat? It shrinks with weight loss, but it never flattens.
Belly fat is it's like the hardest fat to get rid of, and
If
it's
we
also
knew
one
the
that's
answer, we
associated
would
with
be
weight loss.
billionaires. Yeah.
Well, the thing that helps the most seems to be Ozempic and Mounjaro. So, I mean, I know some the weight loss medications that are helping now have been helping my patients lose that stubborn post-menopausal belly weight the best.
Yeah.
But some of it's gonna, no one's perfect. And everybody has a little pooch, especially if you had kids. It
Kids,
doesn't
yeah.
necessarily it's not necessarily a terrible thing, but
Yeah,
it is
there's,
possible.
I think that there's something to be said. My primary doctor, she's very adamant about this country, especially for women, is obsessed with weight a lot of times and not health. And I think these sessions are so good because we talk about health, and it's like staying on top of your health, and body diversity is real. No one's going to look the same, right? Like everybody's a different, their hips are different, their thighs are different, they're tall, they're short, they're round, they're flat. So it's like focusing on your health is so much important, and not about, we've been thrown as women that we have to like look a certain way, and that if we have this little belly pouch that like we're not beautiful, and that's just like, no, we have to stop doing that to ourselves.
It's normal.
Yeah.
It's normal. I mean, people are so hard on themselves, and
especially at the end of the day when you're bloated, you're just, you might be flat first thing in the morning, but it's always bloated at the end of the day.
Yeah.
But everybody is born with a certain amount of fat cells. That's your genes. How much fat you store in them can vary. And again, that's lifestyle and diet. I found recently, I just took up the strength training, and I'm really finding that's helping maintain my weight better than other things I did, because you're building muscle.
Mm-hmm.
And even when you're sitting still, the muscle burns the calories. So I certainly don't have a six pack, and I never will, because, I like my chocolate.
Oh,
but
Pilates are great for that lower abdomen area.
Yeah. I that one yet.
Here's another question. Should you have your vitamin levels checked?
I mean, I check. I mean, it depends on what's in someone's medical history. If you have a history of like any kind of like let's say people have had like gastric sleeve or gastric bypass, like anyone with weight loss surgeries, like I do check more vitamin levels on those people. But I usually do check, like I check a vitamin D on almost all my patients. And then I ask them about their diets to see what other vitamins I might want to check. Like a vegan person sometimes is deficient in B12, for example. So like I tailor what vitamins I check to like the person and how they're eating and what medical conditions they have.
Right. Who should get the RSV vaccine, and is it yearly?
I don't know if it's yearly.
I don't know either. I don't know.
That's a brand new one.
Yeah, that is, because you usually hear it with kids. It's like a first time that like they're kind of talking about it for adults. So that's something
it's very deadly in kids. And they just came out with the vaccine, but there were more people hospitalized last winter from RSV than there were from COVID.
Yeah.
It's actually good timing that it's coming out. And I think, right, again, don't know if it's yearly or not, but they're recommending it in the same kind of high risk, elderly, if you've got lung disease, because it affects the lungs. It's respiratory syncytial virus. It affects the lungs. So, if you've got bad asthma, bad, COPD, bad lung disease for any reason, or you're immunocompromised where you may not do well, that's who it's geared towards.
Yeah. How about, should you request a breast MRI instead of a mammo over a certain age?
That decision is usually, it's actually based on a calculation that they do, and they do the mammogram. They look at how like thick or dense your breast tissue is. If you have denser breast tissue, then they're more at risk of missing like a breast cancer, and those people should get MRIs. Also, people with significant family histories of breast cancer typically go more the MRI route. The OBGYNs are usually really good about guiding that. Another option is sometimes we do mammograms with ultrasounds if someone has a lot of cysts and that kind of things.
That makes sense. Yeah. What is vaginal atrophy, and what should I do about it? Am I saying that right? Atrophy? Yeah.
It's the thinning of the the word for it? The mucus. It's not a mucus. Is it a mucus membrane in your vagina? It kind of is, right? Dr. Duca, it's like after, so when you start to lose the estrogen, that lining gets a little bit thinner. And then you might experience like dryness and discomfort.
Oh, okay.
You know,
so it's vaginal dryness. Yeah.
It's vaginal. It's like loss of the active like vaginal moisture tissue. Yeah. I don't know. There's no, I'm trying to say it in a nice.
My battery is low. I got to go change my plug here.
Anyways, I mean, so that causes a lot of problems. There were a lot of questions in the other thing about dryness and what to do to like help with it. Like sometimes, like, you know, I prescribe estrogen cream like a couple times a week to help with it. Other times, you know, we use natural lubricants like coconut oil. There's a new suppository made of like a moisturizer that you can put in your vagina and apparently lasts for 3 days. Like keeps you moist for 3 days. So I mean, there's things you can do about it. It's not preventable. It's just natural with aging. But
yeah,
there are things you can do to make it more comfortable.
Breastfeeding, because I know when I was breastfeeding my children, because you suppress the estrogen and you can really get vaginal atrophy. So it thins the walls and then it makes sex painful. And again, these are conversations you need to have with your doctor, your gynecologist, because there are options.
Yeah. And somebody made a comment and it looks like they might have deleted it, but I noticed it because they said, you know, talking to your doctor is not easy sometimes. And sometimes the doctor doesn't listen. Then you got to get another doctor because there's really great doctors. And I've seen amazing doctors at Virtua. And if you don't feel comfortable with your doctor, you owe it to yourself to find another doctor who's listening to you, who's going through the process with you. You have to love, I mean, it sounds cheesy, but you have to love yourself enough to get the best care for yourself. And there's a lot of really amazing doctors. And so if you don't feel comfortable with your doctor, just find another one, because you're going to find one that you're really going to connect with. So I think that's the best part of these, is that making sure you realize like your health is so important and you owe it to yourself to take care of yourself as you age. So whoever said that comment, I think that they, oh, really quick. So one more thing, does a DNC to detect uterus cancer?
Wait, what? Does a DNC detect uterine cancer?
Yeah.
We do that. I mean, OBGYNs will do that procedure if they're suspecting uterine cancer. They'll take a biopsy from the lining, or they're scraping out the whole lining, and they can look on like under the microscope to see if there's cancer. But there's a lot of ways of diagnosing uterine cancer. That's usually more of a, I guess it could be diagnostic / treatment.
Yeah.
It's not done like you don't routinely do that. You do it if you're having
issues.
Bleed. Yeah, if you've been done your period for a while and all of a sudden you start spotting, you better be talking to your gynecologist.
Yes.
Yeah, any abnormal bleeding, like if you start bleeding after you haven't been bleeding for a year, then you've got to get in, and we usually order an ultrasound to look at the lining. And if the lining of your uterus is thick, sometimes they do a DNC to check, to like, you know, to clean everything out and see if there's any cancer there.
Yeah. So before we wrap up, 1 or 2 pieces of advice from each of you, or a tip that you would like to share with our attendees.
Dr. Duca, you go first if you want.
All right, I'll go first. I guess the simplest way to put it is know your numbers. You know, you need to see a doctor regularly, especially as we get older, and get the blood work so you know your sugar, you know your cholesterol, get your blood pressure checked so you know that, because you don't feel it. It's the silent killer. And you are worth it. It's important. Take care of yourself. Don't let anybody ignore you, blow you off. If your doctor's doing that, like Nicole said, get a new doctor, because you're worth it and you need to take care of yourself. Yep.
I mean, I only see women, and the thing that I notice the most is that they put a lot of the women I see put everybody and everything before their own health, and they wait years before they even start taking care of themselves. And it hurts, because I'm like, if you don't take care of yourself, you can't take care of other people. You can't work, raise a family, do all these other things if you're not eating well, sleeping well, eating healthy, exercising, doing the basics. And, hopefully staying off of medications is the goal. I mean, I don't ever really, it's not that I like starting medications. I would prefer everybody stay off them, but sometimes you need them.
Right.
Yeah.
Yeah. I mean, there's a reason that modern medicine is amazing in a lot of ways, but also being able to just on a base level, like you said, eating healthy and sleeping well and getting fresh air and getting sun.
Keeping your mental health,
Yeah. Right. Do you find that starts to happen at a certain age with women, that they start to like, is it more moms that kind of?
Yeah, it's like when the kids start to go to college and then all of
Yeah.
a sudden they're like, wait, I haven't done anything for myself in 18 years.
Right.
Yeah.
That's a good example.
You're a cardiologist. I think that
there's only
doctors
so
are the
many
worst
hours
patients.
in the day. There's only so many hours in the day. If you're working, you're taking care of the kids, and you're running to see their games, and you're doing this and you're doing that, and you don't like to exercise, then exercise comes last.
Yeah.
But sometimes you get a wake-up call and said, hey, it's time to take care of yourself. Or sometimes you're just like looking around and going, okay, I got more free time now. Maybe I will take care of myself.
Yeah.
We're all, it's very easy, and I think it's ingrained in women to be the caregivers for everybody else and not ourselves. And we need to not do that.
Yeah. I mean, listen, I don't have kids, but I see my friends, and a lot of my friends' kids are still really young, but I'm like, moms are literally superheroes, but that's a whole other conversation, how dads and husbands need to do more. But that's why we have Gen Z, because they're changing the narrative, but right now it's important that even if you are 60, you still are young and great, and you could still change your narrative. You live to 105, right? So like, you have awesome doctors like the two of you. You have Virtua, which is amazing. So thank you so much for taking your time today and doing this. And, like we said, it's your body. If it's not functioning the way that you want it, that there is absolutely help. And a recording of this session will be emailed to you in the next week. If you'd like to schedule an appointment with Virtua Heart Specialist, just go to virtua.org/heart consult. And if you want a primary care provider, virtua.org/primary near you. And thank you so much. And Dr. Duca, Dr. Miles, so terrific. It was such a great session, and all the awesome questions from everybody logging on and sharing their stories and asking their questions. It means, you want goodness for you. So, and have a great Thanksgiving next week, everybody.
Have a great Thanksgiving. Thank you.
Thank you, guys. See ya.